who needs a liver transplant? What kind of patients and what kind of diseases damage the liver and further liver requires a liver transplant? Now, there are various diseases, there are hundreds of diseases which can damage the liver, but broadly we should remember that liver transplant is required or can be a solution in three types of problems. The first problem is a chronic liver disease. Chronic liver disease is a kind of disease when the liver is damaged slowly over a period of time, and typically it is 10 to 20 years. Now, when the liver is damaged slowly, it reaches up to a stage when it can no longer be managed medically, and now liver transplant remains the only choice or solution for the patient. Second category of liver diseases is called as acute liver failure. Now, acute liver failure is a disease when the liver was perfectly healthy just a moment before and suddenly the liver gets damaged. This is acute liver failure. And third set of diseases in which liver transplant can be a solution is liver cancers. So let's talk about chronic liver diseases. Chronic liver disease in common terms you must have heard of is called as cirrhosis. Now, cirrhosis of liver is a disease when the liver is damaged slowly over a period of time. As I already told you, it's about 10 to 20 years. Now, what causes chronic liver disease? There are many diseases which can cause chronic liver disease, but offhand you should remember that by mnemonic A, B, C and D. A means alcohol intake. If there is excessive alcohol intake, typically said to be more than 2 to 3 pegs, around 50 to 60 ml, which constitutes, one peg constitutes 30 to 40 ml. If we take more than 2 to 3 pegs every day for 10 to 12 years, then it can easily damage the liver and leads to a state called as chronic liver disease or cirrhosis. B and C stands for hepatitis B virus and C virus. These are the chronic hepatitis viruses. They infect the liver chronically and slowly over a period of time they damage the liver and lead it into a state of cirrhosis. D is basically drugs. There are certain drugs which can damage the liver, but the more importantly, D is diet. Diet means that if we take excessive diet, if we become obese, then we land into a category called as metabolic syndrome. In this metabolic syndrome, patient is likely to have hypertension, likely to have diabetes, likely to have obesity and hyperlipidemia. Slowly in these situations, the fat gets deposited into the liver and slowly it damages the liver. Now, this is becoming a very common cause for liver disease and cirrhosis. In Western societies, even up to 1/3 of liver transplants are due to non-alcoholic fatty liver disease, which is due to diet. So, we should always regulate our diet, take healthy diet, avoid junk foods like burgers, avoid heavy overweight, obesity, and that is what the prevention of this disease can happen. Now, as I told you that you should remember A, B, C and D, all these four causes like alcohol, hepatitis B virus, hepatitis C virus and obesity, diet can be prevented. Now, if we can prevent all these four things, then of course we can prevent cirrhosis also. So, the only thing which is required is awareness and bit of knowledge and courage and dedication to avoid these things. Once you get all these things, these things are correctable up to a point, beyond which if liver is damaged, the only choice remains is liver transplantation. Now, coming to our second group of causes for liver transplant is acute liver failures. As I already told you that acute liver failure is a situation in which liver is healthy before and now it is suddenly damaged. There are many reasons. The reasons in the Western society and Indian society are a bit different. In India, we see a lot of acute liver failures because of a virus called as hepatitis E virus. Now, hepatitis E virus spreads through fecal-oral route, which means that if we take dirty water, dirty food, it can spread from person to person. especially the pregnant females, they get attacked by hepatitis E virus very fast. It can suddenly damage the liver and affect the health of mother, child, as well as a need for liver transplant is there once the liver is damaged in a state that it can't be recovered medically. The other reasons are certain drugs. So I always tell my patients that whatever drugs you take, it has to be in consultation with the doctors. For example, a common drug like paracetamol or crocin, which we take for headache and fever, if we take it for a take it without prescription and take it in a higher dose, then it can acutely damage our liver, which is called as the paracetamol related poisoning leading to acute liver failure, which is the most common cause, very important cause in UK and other Western societies. Although we don't see it much often, but we have seen the cases of acute liver failure due to paracetamol poisoning. Other drugs like anti-tuberculous drugs, rat poisoning can also cause acute liver failure. Once the patient lands into acute liver failure, suddenly patient can go into coma, and once the patient becomes comatose, the need for liver transplant becomes very imminent. So all the precautions and prevention has to be taken to avoid acute liver failure. Coming to our third group of diseases in which we need liver transplant are cancers. Now, initially, the liver transplant was not a choice in cancers, but going forwards, the most common cancer in which we do liver transplant is hepatocellular cancer. That is basically primary cancer of the liver. In HCC, the liver transplant has yielded very good outcomes and results, and we can expect 5-year disease-free, recurrence-free survival of around 80% in hepatocellular cancer. Other cancers in which liver transplant might be of help are neuroendocrine tumors and hilar cholangiocarcinomas. So these are the three groups of diseases in which we need liver transplant, and liver transplant can save a life and make the patient well again.